Get ready. Hey guys, I'm here today with Patricia. I just met her last weekend, last weekend, week, kind of both, right? Okay. And at the national conference for Pandas and Pans, and we were talking and kind of hit it off, and I was like, wait a minute. You are insightful. So let's see if I can get you on a Zoom where we can talk a little bit more about pans and pandas and share this awareness. So Patricia, thank you so much for joining me today.
It's nice to be here, Kelly. Thank you for having me.
Excellent. And Patricia, can you just tell people what exactly is it you do for a living before we start?
So I do psychiatric assessments in the emergency room. I see people that are in crisis
Excellent.
and assess to see what the next step is, if they can go home or if they need higher level care.
Excellent. I love it. Thank you for the work that you do because I know it's challenging, very challenging. But I want to ask you, how did you find out about Pandas? Like, how did the awareness come about?
I can go back to the fall of 2017. My son had a lot of it looked like he had a lot of mental health issues all at once, and he had anxiety specifically, and then it looked like he may have had social anxiety, including OCD. So I was trying to get him help, and I ended up in a Lego group for boys his age. And the point of the group was for them to learn to socialize within a group playing Legos. And it was very straightforward. And in that group, I met a mom that told me about pandas, that she was going to get her son checked out for pandas. And so that was the very, very first time I ever heard of it.
How many doctors did you go through before you got to that, or how many diagnoses or
We were so worried about our son. We took him to the we were a military family at the time. Actually, no, we were under military TRICARE, and we took him to the hospital that provided us with medical care. They just basically ignored us and said they checked his blood, but they said he doesn't have cancer. And that's all they seem to care about. And then they gave us a referral, and my son was 8 at this time, for the autism clinic. They're like,
I was gonna say the military is very, very big on autism. I mean, they're putting a boatload of money. They just built a facility, I think in Virginia or something, that's dedicated to autism. So I was surprised that they didn't try to diagnose him with autism.
And the thing that kind of made us kind of take a pause is that my son had been screened for autism when he was 4, through the county, and they were very thorough. They saw him a few times, they checked his hearing, and they said, your son does not have autism. He does need help with speech. We recommend some speech therapy, but we don't think he has autism. So it seems strange to me that that the military hospitals were giving us a referral to the autism clinic, and that was it, that they were done.
Right. Well, like I said, if you spend a lot of money and research in autism, you've got to once again work towards validating those dollars spent. But I have a question for you. So if you're saying that he had speech complications at age 3, and then the pandas was diagnosed, or you started to look into the pandas at age 8, that means that there was a progression towards that state. Did he day 1 stop speaking or have challenges with speech, or was it progressive?
No, it was in the summer of 2017 that we saw a difference in him. He was very anxious. He was afraid of trolls. He told his dad, get a gun. Somebody's going to come and get us. Like there was danger. He got very paranoid and delusional. And then he was a healthy weight. He lost 16 pounds right away. He stopped eating, and then he developed OCD behaviors, like tapping different things so many times, having to do things a certain number of times before we could leave the house. It was just it seemed like it all happened in the matter of a few weeks.
But
and it was very
were there
concerning.
any symptoms, like were there any mild cases of it before then? Like any?
That's a good question. I feel like he had a lot of ear infections, so he was kind of susceptible with getting sick. He had the speech delay, but everything was coming up really nicely at the end of his school year, second grade. I thought he was doing so well speech wise, everything else, friendships, everything, that I thought for sure he's not going to need any more extra help in school. That's how well he was doing. And then the summer hit and bam, we lost him. We started to lose him.
Wow. Wow.
But yeah.
So then what was the process? Then you went to have him checked for strep, and then what happened?
Well, we didn't get him checked for strep.
PANDAS.
We were trying to figure out, even with the PANDAS, I didn't know if that was it. We requested a neurology appointment, and we ended up in Walter Reed, and then he ended up doing an MRI and then an EEG, and to rule out any kind of epilepsy or anything else apparent.
Was he
And
having seizures?
He didn't have seizures. They didn't find any seizures, but they did say to us, this was really interesting because it kind of ties to PANDAS having brain inflammation. One of the neurologists came in and said, your son's MRI, even though it's within normal limits, he goes, I noticed that his brain fluid is a little thicker than normal. But it's still they were like, but it's still within normal range. And of course, that means nothing to us because we were like, what, please help our son. He's not sane. And by this time, he had already been through catatonia, like where that's when they shut down completely. They just stand and stare. They don't talk. They just they're like little, like a zombie effect.
And how long did those episodes of catatonia last?
It seemed like it was just ongoing for months when it hit. So it hit, I don't want to complicate things too much here, but my son also had flu shot injury, and it was right after the flu shot that he went catatonic. So what happens I want to just explain what happens with PANDAS kids is that their immune system becomes overwhelmed. And so anything that can challenge their immune system can just make them worse, more psychiatric symptoms, more concerning symptoms. And in this case, even when I said to you, he lost the weight, he had OCD, he had high anxiety, then we gave him the flu shot because we didn't know at this time that we shouldn't have done that. And then he went catatonic. He stopped talking. He couldn't form words. He couldn't communicate with us. That was the scariest part.
Yeah. I think in part, people started to become aware of what you're saying with regards to, remember with COVID-19, they said you can't have the vaccine if you have a pre-existing condition. So I think people started to become aware of the fact that, sometimes our immune system may not be ready for, vaccines or additional things.
Yes.
And with that being said, I just want to say one other thing is that, not everyone looks into the fact that, like you said, additional things can happen to impact the immune system, but also trauma, emotional trauma, physical trauma, concussions can cause, a leaking, or what we call leaky brain, because it actually causes the causes the passage through the blood-brain barrier. So when we're looking at that, yes, infection, trauma, physical trauma, emotional trauma, so many things that our kids are going through that we don't see because we don't keep necessarily track of them, daily track of them, etc. Did you in any way, shape, or form keep track of the progression? Like, take little notes, say, oh, this is happening at this time, or this is happening at this time, or
I did. We were still kind of, at the time, we were still seeking professional help. We took him to a psychiatrist for a full psychiatric evaluation. It took 6 weeks, Kelly, for this to be done. And at the end, you know what they said? Everything they said he's anxious, he's got depression, he's got some OCD, and he's got some oppositional defiant behavior. And they said, and if you need help, we can definitely give him an autism diagnosis if you need more service. That's
I'm sorry. So my son Jay, when he was 18 months old, the doctors, Dr. Sandy Moran, I don't know if I should say names, in Morristown, tested my son, and he said, "Well, no, he's delayed in speech, but you'll get more money if you say autism. So I can give him an autism diagnosis so that he can get more money or more services." And I'm like, "What?" He's like, "Just trust me. If we go with autism, you'll get more services." And so, even though as we moved along, we were doing everything with the antibiotics and the augmentin. I think we could have been the poster children for augmentin. We did augmentin, allergy shots, you name it. Like we did sulfur-8, the homeopathic route. We did everything, but we really did not see success with either of my sons. My son Jay is PANDAS. He actually had the forceps when he was born. He had the forceps to pull out. Yeah, I didn't drink or anything. So because I didn't drink like at all, when they gave me the Pitocin, I knocked out for 2 hours. And so when I woke up, he actually went back up the birth canal. So they had to use the prongs to pull him out. And when they used the prongs to pull him out, he had pataki on his face. So the trauma actually is what led him to have PANS. And then my younger son, PANDAS, because I had Lyme's disease just before he was born. But
yeah, that there's definitely concern. There's a group of people that are looking at a connection between mothers who have Lyme and passing it on to the kids.
Yeah.
So
my doctor was very advanced in New Jersey, and my gynecologist, and he actually had asked me if I wanted to have an abortion because of the simple fact that the Lyme's could impact my son's brain stems. He said basically that there's 5 areas that are controlled by your brain stems: fine motor, gross motor, cognition, visual, audio. So audio, the ear infections and the hearing of, different things, sounds, etc. Visual hallucinations, cognition, difficulty processing things. So basically what he's saying is my son, autism or PANDAS, we didn't know. He said my son could actually go from, first gear to 5th gear immediately. So so his processing would be off and he would go straight into rage instead of processing situations the way everyone else did. This was my youngest son. Fine motor, poor handwriting, and gross motor, that imbalance, that difficult gait. So yeah, so that was how we began to look into it. Since you've been down this road, since you've been on this journey, what are some of the things that you found that are different, because you are licensed? What are some things you found that are different between, let's say, an autism diagnosis and a PANDAS diagnosis? Like if you were to say PANDAS, like what are some of the things that would lead you to that particular diagnosis? Because there are a lot of people who are just stuck in autism. That's a name that's become familiar.
Yes. This is what I want to say. Even if there is a autism diagnosis, and let's even say right now there's even kids with Down syndrome that are also being diagnosed with autism. Okay. The PANDAS difference is the intensity of symptoms that don't need to happen under autism, such as OCD, severe anxiety, severe aggression, any kind of psychosis. So I feel like in the community, it's an umbrella. It's like an umbrella, like, oh, your child had autism and now they're aggressive. Now they're running away. they're very anxious. This is part of the autism diagnosis. I don't think that's true at all. I think that could be PANDAS that's making all these extreme symptoms come through. But they're okay saying, no, it's just an extension of autism.
Because the funding is with autism. You got to remember, the funding is with autism. So one of the things that my doctor emphasized, like I said, when my kids were born, is the difference in between autism. And I used to work for Autism Center, Autism and Center for Brain Development at Duke. The key difference from autism and PANDAS that I was recognizing was, once again, like you said, the severe aggression, this rage, aggression. One thing that I heard, and I don't know if you noticed this, pretty much every parent that was at the table with us told us that they had experienced their child trying to get out of the car while driving, right? And
yes.
And then if the child can't get out of the car while driving, the child is going to do what? They're going to attack. That's where the rage comes in, And so when you see the aggression, I mean the rage, the attack, that type of attack is more so known in PANDAS, but sometimes can be misdiagnosed with autism because, like I said, that's where a lot of the funding is.
Yes, it's like that's all they want. That's how they want to see it. Oh, you have ADHD and your kid is now aggressive. Oh, that's just part of the ADHD. Or you have a child with just oppositional defiant disorder. And they just want to keep it like that. Keep it in that realm, not to consider that medical intervention may help with these very, debilitating symptoms that affect the whole family, that affect how functioning the child is.
And the thing is, PANDAS is curable. It's treatable, it's curable. ADHD, autism, the rest, they're manageable. You manage them through drugs. You keep the symptoms kind of like down or manageable or controllable, but you can eliminate PANDAS. One of the things is this is Headache Migraine Awareness Month. And I know that also with PANDAS, there can be some headaches and some aggravation that comes along the way. There's also, which was last month, the suicidal ideations.
Yes.
Right now, suicide is the #2 cause of death for adolescents between the ages of 10 and 24. And I just want to say the statistic. One of the things that they are concerned about is the escalation of suicide in the African American community and also the Native American community overall in general, but those two. And with regards to African American community, what they were saying is, and I wrote my numbers down. Wait 1 second. Let me just make sure, because I always try to make sure I get everything right. So within the African American community, there was a 37% suicide rate between 2018 and 2021. And basically, there was a 44% drug overdose, fentanyl overdose amongst African American youth. Basically, what they were stating is, when they talk about the number of suicides that are done by African Americans, it's hard to really tell the number, because basically African American deaths 2.3 times more likely to have an undetermined cause of death, because there's no documentation beforehand. They're less suicide letter. The coroners don't have enough information. The medical examiners don't have enough information. So it's just deemed undetermined, right? How important is it for you, for the physician, for whomever, as a parent, to document information so that when you go before the clinician, they're able to create a more effective treatment plan, they're better able to understand, the trending or the progression? How important is it for individuals to do that, especially when the child's healthy, so you have a comparison?
So it's important to get the child the care that they need right away, especially if you do suspect suicidal ideation. Suicidal ideation can also be an intrusive thought, so it can be connected to OCD. I have met mothers whose kids with PANDAS were writing notes in school saying, I want to die. I wish I was dead. My son, when he was very sick, this was in the next year in 2018, he would cry. He would wake up and start crying. He would say, I hate my life. I hate my life. Something has to be done to help the child. Whether, for me, that was, I never left my child alone. I got him out of school and I stayed with him. I didn't do social work at all, even though I had graduated, and I should have been starting my first job after my graduation in 2018. He was my number one client, Kelly. I said all my social work skills that I just learned in school the last 3 years are going to him. So I got up, I read, kind of, doing all this research, listening what other parents were saying, not leaving him in sight. My approach to his depression and anxiety was the medical approach. Through treating the PANDAS, treating the brain inflammation, I felt this is the way to go. If you are a new parent and your child is depressed, definitely take him in to get seen, get him any kind of mental health support, get him help. If it's PANDAS, wait off a bit on the mental health support, and try to treat and see if that works. So yes, we got to do something. And it could be like me, I didn't give him direct mental health support because we were doing a medical approach, functional medicine at that time. But you got to do something for sure. Otherwise, it's called neglect.
What physicians can prescribe PANDAS? When I get back to that tracking and the progression and that kind of stuff, who can help with the documentation or the tracking?
So so if you go to either aspire.care or PANDAS Network or PANDAS PPN, or even Google PANDAS tracking symptoms, you'll see a lot of tools out there with a bunch. Basically, it's a daily list, day by day, and a long list of symptoms and so you can even add your own symptoms. I believe when I started this, I haven't used it. There was even a app that you could download and track your child's symptoms. So there's a lot of tools out there. Either parents created it or they're on one of these nonprofits, right, that you can see what works for you.
Yeah. I always, I learn a lot by the clinicians, but I also learn a lot by the parents, because the parents are, like you said, they spend 24/7 with their child. And so because they spend 24/7 with their child, they know they can tell you the symptoms, they can tell you, some of the do's and the don'ts, etc., more than maybe an outside person, because they're not with the child 24/7. I was reading something and talking to a couple of individuals, and they were saying that with PANDAS, it was one of the articles I read, I can't remember. With PANDAS, what happens is the kid in school is ideal, right? There's not a whole lot of discrepancies, that kind of stuff. But when 3 o'clock hits and they go home, all that stuff that they suppressed during the day at school comes out at home.
Yeah. Yes.
And the highest time, statistically, the highest time for violent crimes for young adults is between 4 p.m. and 7 p.m., which kind of goes along with the simple fact that, once again, kids are suppressing certain things in public environments, and only people at home get to see the real picture.
Yes, and that's really one of those unfortunate things, because it does make authorities, teachers, medical people doubt what the parent is saying. I look at it like this: if your child can still go to school, send them to school. Even if they unravel at home, they're still in a good place if you can send them to school and they can make it through the day. But as this symptom is a spectrum, my son couldn't even get out of bed until 3 p.m. in the afternoon. There's no way he could have handled going to school. We had to do homebound for him for 2 years, and all he could handle was 1 hour of some kind of basic school with a teacher here a day, and that's it. So if your child, I will say this, if your child is still able to manage the school and break down, you better do some intervention because you're still in a good place. Because because if they progress, they're not going to be able to even leave the house, you know?
My
But yeah, I believe that makes it difficult for everybody to believe what the parent is saying.
my older son, Jay, when he was younger in 6th grade, he took the Peabody test. He scored ninth grade spelling, 4th, 5th grade math, high 2nd grade reading comprehension. And the school psychologist, Julia Zarco, said he needs to be taught at home. She's like, the school, we can't give him what you're able to give him at home. He needs to be taught at home. When I moved to North Carolina in 7th grade, his homebound instructor, Amy Wagner Witt, said, you know, Kelly, I I've never met a kid who could teach me, you know, biology and calculus in 7th grade. She's like, I don't even have seniors who can teach me this. She's like, you keep teaching him. But what happened is, even though they understood it, and the doctors had me put my sons on steroids, we were putting on steroids waiting for the IVIG. And
Mm-hmm.
in a year, my sons went from like 160 pounds to 260 pounds. They just blew up. And they became
Yes.
strong, and they became violent. And I could not manage these kids on steroids attacking, pressing. And the only thing that they kept saying was autism. And we went that autistic route, and it was a spiraling, it just went downward. It went downward. But I did see great success with the IVIG. If there was something that you could leave parents with, because I think we have like 5 minutes left. If there was something that you could leave parents with, families with, etc., what would you say that they could or should do as far as moving forward? It could be even with legislation. I mean, what are some next steps?
So if your child is not getting better, this is what I tell parents at my work. You've been introduced to psychiatric help, mental health help, therapy, group therapy, all kinds of therapies, all kinds of medications. If you keep doing this and your child is still not better, definitely go to one of the websites, PANDAS Network, Aspire.care, PANDAS PPM, see if this might be something that is affecting your child, and look for a provider in your area that can possibly diagnose. And I have to tell you, Kelly, we never did IVIG. We never pursued that, but we did pursue functional medicine, and we did pursue homeopathy. And thank goodness we were able to get him in a stable place without IVIG. But I always knew that people were out there trying to get IVIG, and it was always a struggle with the insurance to cover it. And I think that's kind of why we held off on it, because we knew it was going to be a battle. But fortunately, we weren't needing to go that route, because we were able to get help at a lower level of care that didn't involve IVIG. And so there is many ways out of PANDAS and to treat it. I have to tell you, my son, treatment, he was removed. The school had him under the ASD diagnosis, and they removed it. They just have him under chronic medical issues that affect his learning. That's his autism symptoms that he got when he was 8 and 9 are not there. And so I know that healing is possible, that these symptoms come and go, and that it doesn't have to stay this way. And I have a lot of hope that with more awareness, kids will get.
And Patricia, you said something very, very powerful. So there are stages. There are stages with regards to PANDAS. So when someone is mild to moderate, you can do homeopathic, you can do allergy shots, you can do homeopathic allergy shots, something else, I can't remember.
Like
the nose, the sinus, you know what I'm talking about, the ear infection things, the tubal ligations, but it's something else. I can't remember. Rhinoceros, no, I can't remember. But anyway, you can do those. There's a lot of different things that are in place. But when a child to the very aggressive behavior and you're between moderate and severe,
Yes.
NIMH, they recommend corticosteroids, so the steroid symptom, steroids, antibiotics, and IVIG. So they recommend using all three, but there's a
Yes.
progression. You use the steroids
Yes.
first, and then after you use steroids, then you go to IVIG, or plasma exchange, plasmapheresis. So
I have to tell you something. I told you my son lost 16 pounds.
Mhm.
And the neurologist wanted to do a steroid test, gave him steroids. In one day, our son was like, he miraculously came back. He was back
16 pounds?
One day on steroids.
One day,
Suppressed.
16 pounds?
He lost 16 pounds. So hold on. So in one day of steroids, my son was back to talking. He's like, I need my birthday money. I want to go shopping for my birthday. Then the steroids, thank God, gave him hunger. You were talking about how it caused so much weight gain, but in his case, it brought back his appetite. He gained the weight that he had lost. And it was really great to see that. But of course, steroids are not sustainable. However, we got enough information. We're like, steroids suppress the brain inflammation that was causing him not to be able to speak and not to want to eat, all the PANDAS symptoms. We knew that my son was afflicted with brain inflammation. And so that was a moment where we're like, this is the way, if we can get him back by managing his brain inflammation, we are going to help him get back on track.
I love it. I love it. So just one thing, we have like a minute left. A couple of good questions. How important is it for teachers to also understand this?
It's important because teachers see what the child is doing in school. They could see if they've lost skills like math skills, handwriting skills, any kind of skill. And so having them have that awareness where they've seen the child be different and all of a sudden they change is critical, and they need to be able to communicate with the parents.
Right. Understanding the difference also between PANDAS and autism, right? Versus just lump summing everyone into that, because teachers have the opportunity to write reports that psychologists see when they're actually diagnosing. So they can also influence the diagnostic process.
Yes.
How important is it for law enforcement to understand the difference between PANDAS and autism?
Oh, it's important. I mean, we get kids all the time come in through law enforcement, come in through ambulance. They need to know that like as awful as it looks like when you have an aggressive, ragey child or a child that's running away, that they can't help it, that it is not a behavioral issue, that this is a medical condition causing these behaviors. So don't judge the child's behavior as a disciplinary issue, as parents not doing their job. This is about a medical condition causing them to not be able to reason with themselves or anyone else. My quote throughout my son's sickness is, I cannot reason with brain inflammation. I cannot reason with brain inflammation. If I could reason with brain inflammation, we would have saved time and effort on medical treatment.